Never pop a pimple here within this triangle area that I'm showing you. This photo shows a triangle that goes sort of from the bridge of the nose, it goes down to the corners of the mouth, and to the top of the mouth. This is called the triangle of death or the danger triangle. And no, we do not want you popping pimples in this area. And I know you're saying, well, why? What could happen? In theory, if you popped a pimple here, it could cause a brain infection that could potentially lead to death. Now, let me explain. And also, let me give you some caveats. Now, by the way, I'm Dr. Jen. It's good to see you. Now, this triangle of death, this sort of danger triangle, is something we've all learned about in medical school. The thing about it is we have lots of blood vessels behind this area in our face, vessels that lead to our brain and other important structures. Theoretically, if you pop a pimple here and the infection sort of seeds in a blood vessel, it could potentially travel to the brain, not only cause infection, but also cause major other problems as well. And yes, death is theoretically possible. Now, I keep using the word theoretically in theory, and for good reason. It's because we don't often see these infections. In fact, most of us docs have never seen anything like this. But theoretically, it can happen. Good thing we have antibiotics and stuff like this. Now, I know you're saying, well, what am I supposed to do about the pimple that I have on my nose? Look, we all get them. Ideally, we docs don't want you popping pimples. Why? And I know you're probably saying, huh? You gotta be kidding me. I know. Because most of us have popped pimples or a pimple at some point in time. The reason why we don't want you popping pimples is because it can actually make the pimple worse or the skin worse. It can cause inflammation. It can cause scarring or post-inflammatory marks. It can worsen sort of the lesion. It can cause some damage. What I want to focus on is what to do about pimples if you have them. I grew up and I had pretty bad acne as a child. I've talked very openly about this. My acne was so bad that even when I was actually very young, 13 years old, I was on oral antibiotics to help my acne. I also had multiple creams. I still use creams, and I have used them, the creams, most of my life. So understand that if you have acne, you're not alone, but some great treatments. Over the counter, there's benzoyl peroxide, there's salicylic acid, there's also retinoids, there's things like different gel, so many other things. There's a lot of great products over the counter. And don't forget, your friendly dermatologist and your doctor can give you a lot of different types of prescriptions that may be right for you. There's also steroid injections into pimples. I remember I had a really, really big event one time and I had a big pimple right here, and I went to my local dermatologist. They injected it with a steroid to help me get through that event, so to lower the inflammation and help the pimple go down, and it did. The point being is there are a lot of great treatments for acne. That's not the full list of treatments, but please see your doctor, see your dermatologist, and please avoid picking pimples in general and just be cautious about this triangle of death. Guys, I'm Dr. Jen Caudle, practicing family physician. Let me know if this video was helpful. Please subscribe to my channel on YouTube. Please follow my page on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp, Threads, you name it. Please follow me there. Also, go to drjencaudle.com to sign up for my free health newsletter.